Hey, working moms. Thanks so much for joining me for another episode of the Latika Vines show. I am so excited about today's show. We have a special guest today who is going to talk about a topic that when it comes to taking care of ourselves, we just don't do. We just don't do. So I'm excited about Christina coming on board and just talking to us about what we need to make sure we are okay, first from the inside and then out. So Christina, thank you so much for joining us today. Tell us a little bit more about you.
Well, first of all, thank you for having me on the show today and to spread my message. So I'm the Director of Innovation Programs at Community Family Medicine. So our clinic enters programs to ensure quality healthcare measures are being met. So we do this to have better healthcare delivery. It helps drive patient engagement, and it really builds on that doctor-patient relationship. So for instance, not only is the patient looking out for their preventative care in having annual wellness visits or your mammogram, your pap smear for women, but the doctor's office is also now looking for you, asking you, hey, it's been a year, we need you to come in. So that's what we drive to do.
Yeah, I get those notices. Sometimes ignore them. But that is so awesome.
I know they do a phone call, they do an email, they do a mail out.
Yep. Trash.
Yeah.
Yep. Just with the busyness of every day, it's like, oh, I'll get to that later. Let me put that to the side. But, when your son or daughter has, those same notices, it's like, let me hurry up and get their appointment in, in a date that, works for my schedule, and forget about yourself. And then years go by, you haven't had a pap smear, you haven't had your physical, like, what in the world? So yeah. I
guess as working moms, especially if you have multiple children, the first thing to do is having their appointments. And then if they're all together, like 3, 4, and 5 are very close in age, you don't want to take them all at the same time sometimes, because how are you going to handle 3 children at a doctor's office getting vaccines? So that in itself can take a lot of time and your PTO hours. But we do need to make these days where if we take the last 2 hours off of work or a half day to make sure we're taking care of ourselves, because in the end, if something is detected and it's not treated early, then there's not going to be anybody to watch after those kids or to tell your husband to go to the dentist.
right.
We need to make sure we take care of ourselves.
Absolutely. So let's talk about that a little bit more. So, we do get these notices about, hey, it's been a year since you've had your pap smear. It's been a year since you've had your physical. Why is this so important for us? Just like you mentioned, we got to make sure that we're okay before,
Yeah.
we're no longer here. So dig deep into why it's so important for us to pay attention to those notices and actually go to those appointments.
So I think insurance companies have noticed that if something goes undetected, in the long run, you will end up in the hospital, you will end up with multiple surgeries, and that increases costs for everyone, not just for them, for the providers, for the patients. Everybody's costs has increased. So they've decided along, of course, with the CDC and is to do preventative measures. So preventative measures is looking at if you have diabetes, they look at your sugar level to make sure it stays leveled so you do not end up in the hospital. Also hypertension, and then eye exams, and then depression screenings, and then of course mammograms and pap smears. And for women, that's very, very important. So for pap smears, it says from ages 35 to 44, they are the most frequent to have cancer detected. And so early detection is really important. And then also the treatment follow-up is the second stage. So not only are you going to go get your pap smear, but if something comes detected, you also have to make time as a working mother to investigate further what's happening, what's going on, more appointments. And then once everything is resolved peacefully, you have to remember about the after treatment. So the after treatment is making sure you go the following year or in 6 months, whatever your doctor is preferring you to go. And so this year alone, the American Cancer Society is predicting 1,400 new cases of cervical cancer, and about 4,000 of those women will not survive. So, and it gets even worse with, of course, breast cancer. So breast cancer screening, it should be done every 2 years. The US for 2020 expects 200,000 cases, and 42,000 of those women are predicted not to survive in 2020. It's really, really disheartening. So in 2007, it was noticed that women under 50 were starting to have some breast cancer issues. Usually before, it was mostly screening of women 50 and older for breast cancer screening. But now, part of the preventative measures is looking during the pap smear to also do the breast exam, just to feel if you feel any lumps, starting as early as 21, to see if there's anything there. And they have noticed women who are 35 to that 50-year range have gone for mammograms or ultrasounds to see if there's some invasive lump. And so that's very important, because if it is something that needs to be addressed or surgically removed, we don't want it to grow. And so that can be very devastating to the family and also your job. You know, us as working women, we're so into our work and we love what we do. And you can't be taken away from all that. You really have to make sure that you're getting this annual wellness visit. And it's done at no cost. There's no copays. Your insurance covers it 100%. Of course, if you go in for another reason, like you have a cough or a fever, of course, you know, there will be a copay. But for this annual wellness visit, it is covered fully. Mm-hmm.
That is so important. It is covered, you know, so there is no reason why we shouldn't be going to the doctor, you know, for these exams, you know, to make sure that we are healthy. But what do you tell the woman who notices there's something wrong and the doctor says it's in your mind? You know, I went to the doctor um, after having my fourth child, and I, to my gynecologist, and I was like, look, I'm having these pains, and I'm having pain just walking. I'm having increased pain during my period. Like, I'm having increased pain.
Mm-hmm.
But she told me and my husband, because my husband was in the room with me, that it was all in my head. So, what do you tell the woman who notices there's something? She goes to the doctor, and the doctor was like, you'll be all right. That's discouraging, you know, so you don't go back to the doctor. So what do you tell that woman?
I mean, first of all, it is hard to find a provider that really listens to you, because they are very busy. They're seeing patients every day. And it would be nice, I know as working mothers, but to start to develop a doctor-patient relationship, finding the doctor that's fit for you, regardless if it's a cold or a cough or earache, finding the person that you can talk to and you feel they are listening to you. But second, if I had a major issue like pain, you know, I would get a second opinion, and even a third opinion at that. Because at times I've had those situations occur as well, where there's an issue and they're not listening. And I remember going to the second doctor, and I remember I ordered my own ultrasound and my own mammogram, because they're like, your age is not met to standard. But I was having this issue, and I'm glad I went, because I discovered a lot of things about my own body. So that was important for me. So, I mean, definitely getting the second opinion, even the third, but then also speaking up. I have dealt with physicians where they're like, we don't want to send you for screening. There could be a cost associated with it. And you as a patient, you have a right to speak up and say, no, I want this mammogram and I will pay for it. So, yes.
That's really important. That's really important.
Mhm.
So it's important for us to have, you know, the second or third opinions, you know, if we do notice something. And, you know, but first making sure that we have that doctor patient relationship. So making sure that you have a trusted doctor, a doctor that you can trust, and can be honest with you, can be real with you. So can you give some tips on maybe what a woman can do to make sure that she can develop this doctor patient relationship? She can be comfortable with her doctor to say, hey, I may be having some issues, but I'm not comfortable saying it, and maybe that doctor can kind of pull it out of her.
So comfortability comes in a various form. I do know a lot of women that go to their primary care for their pap smear. I know some of these women or patients, they take their whole kids to that physician and go to that physician and they have their pap smear there. To them, it's healthcare. I'm there for a reason, and that's healthcare. Then there's some women who are like, I'm not going to see my PCP, my primary care doctor, for a pap smear. I'm going to go to my OB-GYN, my gynecologist. And so they develop their relationship with their gynecologist, who does the pap smear screening, but they also can do the mammogram checks. Honestly, I have my primary care physician, but I also do have my OB-GYN. And so for my OB-GYN, she's delivered all my babies. I've known her a very long time. And she is the one that I do feel more comfortable going to those kind of visits. So my doctor's office does call me saying that they're needing a pap smear report because they're needing a date for the insurance company to make sure that I, as a patient, am doing what I'm supposed to be doing. I tell them I will schedule my own appointment with my gynecologist, who I love and feel very comfortable with. So I'm hoping all moms can find that. I know with my first son, my gynecologist, she was an OB, she retired. And I was so sad when I was having my second son, because I was like, don't leave me. I need you to help me birth this baby. And because I trusted her, and she's seen me so many times, I felt so comfortable around her. So it did take 2 or 3 other doctors for me to find the right fit. And now I love the physician I'm with. I go to her all the time. She had delivered my second baby. And anytime I need a screening, she's the one I go to.
That's really, really good. I also have my primary and also have my OBGYN. And I tell you, I can talk to each of them in a different way, so my primary care, like I can, and we share the same birthday. So we can talk, and my OBGYN, we have a special bond because we've been pregnant at the same time. We delivered at the same time. Outside of my oldest daughter, she's delivered my, 3 other kids. So yeah, we have that special bond. So I definitely get, having separate, and even my husband and I, we have different doctors. He has his primary care and I have my primary care. And he feels comfortable with his doctor, and his doctor is a female. And he's been able to, really share things with his primary care doctor, who's a female, and he feels very comfortable. And I see him feeling comfortable sharing things with her that he normally wouldn't share with me, because it's personal. But I do see that it's so important for us to have those relationships. It's really, really important for us to have those relationships. So we have our pap smears. And I know during pap smears, we also have to do the breast exam. So the doctors do the breast exam. But it has been, like, for me, on my father's side, breast cancer runs in my family like crazy. I have, I think it's been 8 generations of breast cancer in my family and on my dad's side. And when I found out my aunt, my dad's sister, was diagnosed with breast cancer, it scared us all. But then, I was an adult, so I was like, okay, does this mean that I need to go get checked? So can you talk a little bit about that? Because, we may have different cancers or diseases running in our family, and it may be that, we are not, I mean, even though we're related, we're not that, related to that family member, or maybe we know that is our medical history. What advice do you give to a woman who knows certain things run in her family? She may not have any symptoms. She may, be healthy, active, all that good stuff. But what should she do?
So first of all, I'm not a physician. I I'm quality assurance, but I can answer your question. I just
Disclaimer.
I'm not a physician, but I can help you answer your question. So I do know 1 in 8 women in the US develop breast cancer. And so yes, you're correct. Most of the time it has been genetic, but there are times where it's not genetic and they're saying it could be environmental factors. I mean, there's so many reasons to cancer, but most of the ones I believe we've seen are genetic.
Yeah.
Um, I mean, I would say get tested. I know as well in our family, my mother has 7 sisters, and out of the 7, one of them did develop breast cancer. At that time, it alerted me that I need to be careful that if I feel a discomfort or pain or a lump, then I do have to get that checked. And now I know even if I do not develop cancer, it is my duty to tell my daughter. So my daughter is only 4 years old right now, but I need to make sure as she gets older to let her know that she needs to get a breast cancer screening. Or I mean, the screening at times, it's people think, oh, a mammogram, I have, it's going to cost a lot of money, or it's very, I have to lay there. If they have to do an ultrasound, it's going to hurt. They press on it, all these things. But really, the first screening is the physician laying you down flat on your back, and they're feeling if they feel any lumps. And usually, if that's a green light, then you're good to go. You don't have to go to the next step. So that's really what the screening is. The second step is if they do feel something, then it goes into the mammogram. And if the mammogram is inconclusive or they feel they can't see something, then it's the ultrasound. But the screening is actually just the physician feeling to see if they have any lumps, which I know they have the bosom buddy program at one time, and they were big on that. And they, you're supposed to be check to see, and they have this check in the shower, how you can raise your hand up and touch and feel if you feel any lumps. But of course, if you ever are worried, I mean, even have seen women between 18 to 25 who have gotten that news that their mother has gotten breast cancer, they panic and they're worried. And yes, the right thing to do is to go to their physician, because their physician will know what to tell them what to do. They'll to let them know that it's okay, don't worry, but this is something we can monitor and check. But that's the thing, you can't have 5 years or 8 years pass by and you haven't had a screening. And I think that could be a problem with many working mothers, is you look up and you're like, okay, in April, my pap smear was due and it's already going to be August and I didn't do it. And when am I going to schedule it? So the time seems so fast at times. So we just need to make sure if we put it in our phones or have some kind of alert go off. But like I said, usually nowadays your doctor's looking for you via phone or postcard somehow, or
Yeah.
email now too. But it's always good to have it yourself.
Yeah.
Near
That,
you.
that's a really, really good piece
Mhm.
of advice is just go. Just go to the doctor. Um,
And
and
recently, now that I've talked to many women about breast cancer and pap smears and just overall annual wellness visits, depression screening, diabetes checks, eye exams, dental exams, I've had a lot of women tell me, oh, I get that done. You know how I get it done? I always do it on my birthday or like near their birthday, the week, their
Mhm.
birthday. That's part of their birthday week, is taking care of themselves, doing the annual wellness visit and making sure everything's okay, then going to dinner and hanging out with their friends and their family. Those are things that need to be built within our social settings so we can make sure that in the future we're not going to have any kind of harm in pain or cost. Fighting a battle of cancer can be very, very expensive, and we
Yes.
can prevent that.
Absolutely. I love your tip of, making sure that we make sure we take care of ourselves. And that's part of our routine, part of our routine, like the example of taking, going to the doctor around your birthday or on your birthday. And, you know, as an annual reminder, hey, I'm blessed to have another year of life. Let me go make sure I'm okay. So I love that idea of, just making sure it's part of our routine, that we do take care of ourselves. Um, and, we talk about, um, I mean, we are in the midst of crazy times right now in the world. And some people may be afraid to go to the doctor. Um, they may get that phone call, hey, you're overdue for your appointment. But again, when we make sure that we've incorporated ourselves in our routine, even being in COVID-19, we still need to go. We still need to go. And the doctor's offices have made sure that they're safe, they're sterile, everything is okay. Um, but we still need to go in the midst of a pandemic. We still need to go. And that we just shouldn't fear. We really shouldn't fear about what's going on in the world. We still need to take care of ourselves, because despite what's going on in the world, we're still one person. We're still taking care of our kids. We're still making sure that our husband's okay. We still trying to take care of our house and, handle whatever, however, gotta make sure that we are okay. So I love your tip of making sure this is a routine. We take care of ourselves. I love that so much.
And I think also talking to your friends about it,
Mhm.
because I've had my 16-year-old, he's been at the same school forever, and I've had the same group of 6, 7 women that we've always hung out together. And, we never really bring it up, but three of them are nurses. So one time it got brought up. And we're like, oh, wow, I haven't gone for my pap smear or my mammogram. And we all started talking about it, and it just bonded us so much closer.
Mm.
So I think it just takes that one person to bring it up in the group, because we all do it, but sometimes we don't always talk about it. And of course, it's that feeling comfortable, but I mean, we have to keep in mind it should be comfortable for any woman, because we all have to have it to get it done. So,
Right. That is
mhm.
that is so good. Making sure that we can talk about it. So having a community where we
Yes.
do feel comfortable in saying stuff that normally is bedroom talk. Yes. Awesome. Do you have any other tips or advice to give working moms when it comes to taking care of themselves or going to their exams?
Um, the main tips I would give, I know it's easy to make the appointment usually. You just call or do it online. But the hardest part is to go to the appointment. Go to the appointment. I can see many working moms an hour before standing outside their workplace calling and saying, I'm not going to be able to make it. Let me cancel. I have this meeting. And everything becomes, or I have to go pick up my kids earlier. Everything becomes more important. So, really scheduling that time. And then after they go, to follow up on the results. So, at times, physicians, especially if there is a red flag, they'll call you right away. But I'm the type of person that I want to hear it was all normal. And many offices still do that, but some offices usually now, with how many patients they have there, they tell you if it's normal, we will not be calling you. So that's a good thing. But I always like to follow up and just make sure it says normal. Or I look in the patient portal and make sure that I can see it and it says normal, and I'm happy for the rest of the year. So, and then the last thing is just that tip of putting it within your phone, so it can go off and you remember that you have it done. But I do like the birthday week. If you just do everything during your birthday week, then you're good the rest of the year. And that's the time you're going to focus on your kids and their vaccines and your husband and your house cleaning and your job and PTA meetings.
Yes. That is so important. I really love that birthday week. Making sure that you can incorporate in your birthday week, because I think that's our reminder. You know, it's another year of life. We need to make sure that we're okay. I really love that tip. So, y'all, Christina said, make sure you make that appointment. But not only do you make it, but you go. Make sure you attend or call. Make sure you have some type of follow up, and make sure that you can put it in your phone. So, like, I was just thinking, if you finish going to, you go to the doctor today, maybe have it in your phone, like, next year at this time, I need to be at the doctor, some type of reminder. And with Google, you can set goals and reminders. But I love that tip of just putting it in your phone, setting that reminder that you have to do it. You have to do it. Because, man, if you don't, Lord have mercy. We really have to take care of ourselves. It's so important, especially now with COVID. And, we just have to take more care of ourselves, or better care of ourselves, and it really starts from the inside, making sure that we're okay.
So with COVID, thank goodness insurances have recognized the fact that many people may not want to go to the offices.
Yeah.
So they are allowing telehealth annual wellness visits. It has to be audio and video. So the preventative care is a little harder to do,
Mhm.
especially for women. So you may still have to go to those appointments, but you're absolutely right. They are wearing masks. They ask you to wear a mask.
Yeah.
There is a waiting room mostly now. You're waiting in your car until you're called. So it's very safe. Take your hand sanitizer with you,
Mhm.
and then you'll get the care that you need, the care that you're paying for. Make
Right.
sure that you're using it and you're getting your results so we can live happy, long lives. And especially so we can see our children grow, go to their weddings, see our grandbabies.
Absolutely. That is so important. I love that, Christina. We need to take advantage of what we're paying for.
Yes.
that I, that's such a really, I mean, if you put it down in that perspective, you're paying for help.
Mm-hmm.
You are paying for it. So we need to use it. It's there. We need to go ahead and use it. I love that tip. I really love that tip. I really do. Well, thank you, Christina, for being with us today. I really enjoyed this conversation. It really gave me some things that I need to do, and make sure that I go ahead and make that appointment for my pap smear. It's just so important that we take care of ourselves from the inside. Make sure that we, like you said, we're paying for the health insurance. We need to take advantage of it. Um, so it's so important for us to really do that. So I really thank you, Christina, for being on the Latika Vine show. I really do.
Thank you and everything you do to help spread the word for working women.
Yes, thank you. Thank you. So, y'all, I really appreciate y'all being on the Latika Vine show. And don't forget to like and subscribe so that you can hear more tips, have great conversations with your friends about what we're talking about. Thanks so much, Christina, for joining us. And y'all have a good one.